The wrist is a complex joint composed of bones, ligaments, muscles, and blood vessels. Movements such as flexion, extension, and deviation allow daily and functional activities. Understanding wrist anatomy and function is essential for physical therapists and patients to support injury prevention and rehabilitation.
The wrist consists of 2 rows of carpal bones: proximal row, scaphoid, lunate, triquetrum, pisiform; distal row, hamate, capitate, metacarpals. Ligaments stabilize the wrist and allow controlled movements. Key ligaments include dorsal and palmar radiocarpal ligaments, palmar ulnar carpal ligament, radial collateral ligament.
Wrist flexors, extensors, radial and ulnar deviators, and forearm rotators control wrist movements. Coordination of these muscles is crucial for rehabilitation after injury. Wrist range of motion (ROM) assessment includes measuring flexion, extension, radial and ulnar deviation, and rotation. These assessments are critical for identifying limitations and planning rehabilitation programs.
Physical therapists can use AI to analyze wrist movements, track performance, and design personalized rehabilitation plans efficiently and accurately. The following exercises and assessments target specific wrist movements and can be monitored using AI to ensure proper form and progress.
By performing wrist flexion with weight 3 times, the patient can strengthen the wrist flexor muscles while the physical therapist evaluates range of motion and movement quality. Since this movement overlaps with assessments, it is used in the platform both as an exercise and as an assessment.
By performing wrist extension with weight 3 times, the patient strengthens the wrist extensor muscles, allowing assessment of wrist function and progress. Since this movement overlaps with assessments, it is used in the platform both as an exercise and as an assessment.
By performing wrist radial deviation 3 times, the patient targets the radial deviator muscles while the therapist monitors motion control and functional improvement. Since this movement overlaps with assessments, it is used in the platform both as an exercise and as an assessment.